Now, people who live in overcrowded spaces, including prisons and informal settlements, are on the Health Ministry's priority list of the COVID-19 vaccine rollout. At the back of the queue are many younger, healthier taxpayers who live in informal housing and provide fuel for the economy. Many people feel it's unfair for taxpayers to fall behind prisoners in queues to receive the vaccine. DA politician James Selfe is one person who holds this particular view. He's the party's shadow minister on correctional service and joins us now live on air. James, good morning, good afternoon, and welcome to the show. Thank you so much for your time. I'll jump straight into this. I spoke earlier to the spokesperson of the Minister of Justice and Correctional Services and asked him if it's indeed true that prisoners are on the priority list for the COVID-19 vaccine rollout. And he said to me that government has not yet announced on a COVID-19 vaccine protocol. So I'd like to ask you, where did you come across the information that prisoners are indeed a priority when it comes to COVID-19 vaccine rollout?
Well, there was a report on News 24 that said that Professor Barry Sho, who is the chairperson of the Advisory Committee on Vaccines, had said that, amongst others, prisoners would be prioritized for the rollout of COVAX amongst the first 10% to receive the vaccine.
Is this an official report, James?
That was certainly an official report, and it wasn't denied by any spokesperson.
Okay, let's get into the substance of it. James, why should prisoners who still have their human rights intact as pertaining to the Bill of Rights in our Constitution, why should they not be considered a priority for the COVID-19 vaccine, given that they quite literally are in confined spaces?
Yeah, they are in confined spaces, and I do concede that, and that constitutes a particular risk for the custodial officials, who I do believe should receive priority treatment because they're in danger enough as it is, and they shouldn't be exposed to more danger. But lots of people live in confined spaces in South Africa. In my own constituency, there are informal settlements in which people are literally living cheek by jowl. And we don't see that convicted prisoners should receive priority treatment ahead of honest, hardworking people who also are entitled to get the vaccine.
Well, what about committing crime denies you to priority when it comes to the access to health?
Well, it's quite simple, really, because if you give a prisoner priority treatment, then somebody else has to fall off the priority list. So if you're giving 125,000 convicted prisoners the vaccination, it means that 125,000 other people drop off the list. People who are elderly, people with comorbidities, people who are living in confined circumstances.
Well, James, that makes the assumption that the COVID vaccine is some sort of zero-sum game where there's a finite amount of it available and it's about who gets it and who doesn't get it, when the real question should be who should get it first, who should get it second. Now, again, I'll bring the question back and I'm asking you to make a normative argument and give me a value judgment about what about prisoners denies them the right to priority when it comes to the access to healthcare, specifically life-saving healthcare as the COVID-19 vaccine would be. Does committing a crime make you a less of a South African citizen?
Well, it certainly impinges on your right. That needs to be clear, that when you're convicted of a crime and sentenced to imprisonment, you lose certain human rights. You lose the right to free access, you lose the right to mobility, etc. We would argue that it is a finite game, that the first 10% will be rolled out, according to Professor Sharp, to frontline health workers, persons who are over 75 years of age and living in an institution, essential workers, and then prisoners. Now, we don't see that prisoners should deserve a priority treatment when it comes to the access of that first 10%, because it means that somebody else has lost the right to that access.
James, would you make the same argument if some of the prisoners we're speaking about are prisoners who have comorbidities, which would make them high-risk COVID patients, Would you make the same argument if some of those prisoners are over the age of 75?
Of course, they must get the treatment, yes. People over 75, people with comorbidity, must indeed get the vaccine, but not all prisoners.
Okay, I want to bring this matter to you. Now, your head of policy in the Democratic Alliance, Gwen Ngwenya, responded to your position on this on Twitter, a tweet which she has since now deleted. And she said that this is a flawed position, one that's not in the principle and in the vein of what the DA stands for and should be rethought at least. Do you feel the same way, that your head of policy disagrees with you?
I certainly don't. Gwen is entitled to her own opinion, but what I expressed is the official position of the Democratic Alliance.
When was this made official? I mean, I don't remember the Democratic Alliance having any meetings, at least not at a EXCO level, at least not at a national executive level, and definitely not at a policy level. Who did you consult before you made the statement?
I consulted the Justice spokespersons, Glynis Breitenbach and Werner Horn, the Chief Whip and the leader, and the statement was approved.
So this is a statement that's supported by John Steenhuisen?
Correct, it is.
But what do you make of Gwen Ngwenya's rebuttal to this? Do you think it's one the DA should entertain?
As I said, we believe in a free society. She's entitled to a point of view, but it doesn't happen to be an official point of view of the Democratic Alliance.
Okay, James Selfe, thank you so much for your time. Really do appreciate it. That is James Selfe, who is the Shadow Minister of Correctional Services in the Democratic Alliances.